Hi, welcome to Skin Hidradenitis, where we will start our cozy skin series. And this is where I try to be your cozy go-to place for today. And we're diving deep into the bane of many people's existence, hidradenitis suppurativa, also known as acne inversa. I like to just say HS because I'm not going to keep saying hidradenitis suppurativa over and over again in this podcast. So before we start, I need to prefix that this is a independent project for my university degree. This also means that I'm not fully qualified in any sense to provide this information. This is purely for my own interest and possibly your interest, so I hope you enjoy. And something I always learned that was really important in my time in uni is that you should do your own research. So while I hope everything I say is accurate, fingers crossed, take everything I say with a grain of salt because there's really nothing to say I can't be a little filthy liar giving you false misinformation. So as always, do your own research and enjoy. And if you're interested as to what the music in the background is, this is by Stream Cafe. So to start, picture this. Painful, reoccurring boils and abscesses in areas like your armpit, groin, and under your breasts. That's what HS is in a nutshell. But it's more than just a skin issue. It's a chronic inflammatory skin condition with a significant psychological impact. Interestingly, Interestingly, I was bored, so I was reading a paper about HS, and to my surprise, found out that about 481 patients in this study with HS, about 99% of these people retired below the statutory retirement age, so before the average baseline for retirement, meaning a lot of them retired due to possibly the embarrassment of having HS, and that's something I really sympathize with and what motivated me to start this series, specifically for my university degree. So what's going on beneath the surface? Well, HS starts when a hair follicle becomes defective and gets blocked. This leads to inflammation, nodules, and eventually abscesses under the skin. These obviously can rupture, causing discharge or spilling its contents like our keratin, which is our skin cells, or bacteria into our surrounding dermis and epidermis, causing scarring. Something we call our pilosebaceous unit also gets destroyed. Now, pilosebaceous unit is our hair follicle, hair shaft, and our sebaceous gland, our oil glands, or sweat glands, basically get destroyed due to a chemotactic inflammatory response. And these occur due to our neutrophils and lymphocytes acting up a little bit. There are also other possible reasons that HS develops, with some of the major players being abnormal secretion of apocrine glands. So these are also our sweat glands, so our keratin, bacteria, or just more sweat becomes, released. Something called abnormal invaginations on our skins could occur, which is basically our skin, or what we call epidermis, so our top layer of our skin, folding inwards or penetrating the outer layer of our skins, the epidermis. And this is typically seen in different types of skin tumors, so cysts or other abnormalities. Bacteria is another large one that we see, although it doesn't really seem to be a primary cause of HS, because typically the lesion can lacerate or rupture, and this allows for many, beautiful breeding grounds for our little bacteria, like our little critters in there to colonize, eat up, cause an infection, and worsen the HS in a lot of people. Now, when it comes to diagnosing HS, it can be quite challenging, because in its early stages, it can actually mimic a lot of other conditions or be mistaken for a lot of other conditions such as acne, boils, or herpes. Interesting with the acne, because it's mistaken for acne so much, that's where the name acne inversa comes in. And it usually takes an average of 7 years to get the right diagnosis for many people. So if you think about it, going 7 years without getting the proper management or treatment, or just not knowing what your skin condition is, can be really daunting, because no matter what they try, it never seems to get better, so they just think they're stuck with it for life. Although, yes, you are stuck with it for life, there are ways to get it not treated, but lessen the severity of it, which we will speak in the next episode if you enjoy this one. So there are early signs. So early signs of HS might include burning or itching before a lesion appears. And speaking of lesions, these lesions are quite deep-seated nodules. So basically, they're very deep in the skin and they sit there for a while, and they can persist for months, years, and are often mistaken for boils. And half of the lovely people with HS will report a range of symptoms, which can be, but are not limited to, stinging, pain, pruritus, so that's just itch, warmth of hyperhidrosis, also known as just really intense sweating in the area. And this happens about 12 to 48 hours before a lesion pops up, serving as sort of a warning, which, can be noted for a lot of people to know when to prepare if they're gonna get new lesions. So like the main sort of lesions most people will see with HS are just very deep, like sitting nodules, and these are typically maybe 0.5 to 2 centimeters in length, and these can last from days to months or even years again. And when multiple of these nodules happen to occur in the same area, this can lead to tunnel formings under the skin as they start to basically interconnect. And because they connect, they can possibly ulcerate or drain. With the draining, which, as prefix, is completely fine to have, for this to happen, but with the draining, the smell that comes out can be quite intense, which is obviously a cause of embarrassment for many of the people suffering with HS. And it's completely fine. There are ways to mask it, but there shouldn't be a time when someone should be ashamed of it, because people are people, it happens, it's not like you control it. So now let's talk about stagings of HS. And we've got about 3 stages which are called the Hurley stages, and these basically categorize someone's HS into different stages of severity. And this is coming straight from an article written by Kimberly Ballard and Victoria L. Schumann, and they describe HS in 3 stages. And Hurley stage 1 is abscess formation of tracts or scars. Hurley stage 2 is recurrent abscesses with sinus tracts and scarring, and there may be a single or widely separated scars, in different areas. And Hurley stage 3, which is the final stage, is diffuse involvement, multiple interconnected sinus tracts. So when I talked about, sometimes the lesions connecting, allowing for the trapping of that bacteria and all those fluids, and abscesses across an entire area, leaving little to no uninvolved skin. So basically just everywhere you would expect to have it. So like under your armpits, under your breast, anywhere that there's flexion. You can think of it as when you bend your arms above where the elbow is. In those areas, you're really susceptible to HS. So who's really at risk at it? Well, HS often kicks off at puberty, and it hits its peak between ages 20 to 40. It is much more common in women, and risk factors include basically family history. So those with a family history are 30 to 40% more likely to have it if at least one other member is affected. Obesity is another one, as there is a greater surface area, and a greater surface area basically means more skin friction occurring. Obesity also causes excessive androgen production, which we know that there's links to that and contributes to HS. In going off this, there are links between hormones and HS, with the highest rates of HS seen in those in puberty, like we mentioned before. And while in specifically in females, once they reach menopause, we see that basically the severity of HS seems to calm down in a lot of cases, because that's when, as many people I'm sure know, that's when our hormones start slowing down. And the severity of HS starts to lessen. Yeah, so the fluctuation between the acute and symptomatic episodes and the severity of one's menstrual cycle also has an effect on it. Smoking is another big one, which leads to the plugging of some hair follicles, and certain skin conditions or disorders like psoriasis, acne, or hirsutism are a big player in the development of HS. One very large one that we've seen is Crohn's disease, as from what we know, interestingly enough, there is a much higher prevalence of HS in those with Crohn's disease compared to just the normal general population. So both HS and Crohn's disease have very similar pathophysiology, so just how they develop. such as the inflammatory and immune dysregulation. So this could be a clue for many people to understand this. So those with HS or your practicing clinician, so your doctor may consider screening for one condition when the other is diagnosed, so that the treatment strategies may need to address potential comorbidities. So if you have Crohn's disease, you might have HS. If you have HS, you probably have Crohn's disease. So if that could be a potential link that you could bring up with your practicing GP or doctor, or something you could notice yourself and you could bring it up. So what essentially causes HS? That's still a little bit of a mystery. We know it's an anti-inflammatory syndrome, and it involves factors like follicular occlusion, so the closing of your hair follicles by maybe some products, maybe scarring occurred in the area, an abnormal microbiome, or an inflammation triggered follicle rupture. There are many complications that can occur with HS, both on a physical and psychological level. Physically, due to HS being a chronic condition, the reoccurrence of the lesion is bound to happen for the rest of your life, potentially, and this can lead to previous mentioned abscesses, tracts, and scarring in the area. And this can just cause constant chronic pain. Like, the pain with HS varies, but in the most severe cases, a lot of people, not to put not to bring down the vibes or anything, but those people do consider, taking their own lives. In those sense, it is a much higher prevalence with people with HS. So it's really unfortunate that does happen, and I hope, treatment options do get developed. But moving on off that point, limb contractures and impaired mobility also occurs depending on where the lesion is. So if it's on, your flexures or whatever they call the folds of your skin, they could really, mess with your walking and, picking up of items. And these are really just the tip of the iceberg when it comes to this condition. In the long term, the effects of the chronic inflammation can cause anemia due to the constant leakage, which can actually include blood in many cases. So, hyperproteinemia and amyloidosis, which basically are the buildup of proteins, can clog the area of the body or cause axial or peripheral atrophy, so just the loss of muscle in those areas. Now, in super rare cases, there is a risk of something we call squamous cell carcinoma, and this is a form of skin cancer. This is a lifelong worry in some cases, because there have been cases where individuals are diagnosed 30 years after a HS diagnosis, and there also seems to be risks of buccal and hepatocellular cancer, although the evidence for this was just from observational data. So it was just, the study didn't focus on this, they just saw it and like, oh, there is a link. Wow, interesting, note that. So the risks were not intensely investigated, unfortunately. The psychological impacts of this also should not be ignored, with the combination of pain coupled with that drainage we talked about earlier that has an intense smell accompanying it, and the deformities due to the scars and atrophy of the area. Many people feel depressed, socially isolate themselves, and have decreased relationship satisfaction due to all the worrying, sexual dysfunction, and reduced work productivity in extreme cases, like I talked about earlier with the people, I think 481 people retiring before the statutory retirement age, so the average retirement age. And as we talked about before, people have also taken their lives because, like many skin conditions, it's not just skin, it's skin deep. Or even deeper, however you want to take it. So there you have it. So that's about it for this episode. So HS is more than just skin deep. It's a complex condition with physical and emotional consequences. But the awareness and understanding, we can work towards better treatment and support for those living with HS. So we hope in the next episode, we will shimmy into and focus on what most HS sufferers are interested in, and this is treatment and management options, and how you can prepare for appointments if you believe you do have HS. I hope you guys enjoyed this. Oh, forgot to say, my name is Danny. I was your host for today, and goodbye.